Hello. I'll give you this one here.
Oh, la, la. Okay.
So you look so professional.
Fine.
Thank you so much for being here, Nicola.
Fine.
I can't believe it. She had tickets for some theater show, and yet she decided to see you guys. So thank you so much. Why did you want to have a facelift again?
So my first facelift, I was told it was deep plane, great at the beginning, but then it, like you explained, the jowls came back and I was just like, I was unhappy. And I'd had a lip lift with you. I trusted you, the lips were great, and we just built up that rapport, that confidence. I just knew that you weren't doing facelifts at the time.
Yep.
So, and then when you said you were going to start doing facelifts, so that's when I thought, oh my God, I just need you to do it. Yeah.
So How did you feel? Because we had a rhinoplasty, we did a facelift, we did the lips.
I know, when you say it like that.
And, yeah, because we are in England and everybody's judging. We would be sitting in Los Angeles.
Yes, I didn't own it, like you were saying, which I think is really good. Now I own it, but at the time I felt quite...
You were judging yourself?
Yeah.
Guilty pleasures?
I was just thought, and I've got 3 young adults, so they were also giving their opinion.
I remember you telling me.
So, But now I feel more, I just feel confident. I look in the mirror, I'm happy, and I don't look back.
Is there anything from the details that you saw previous the surgeries that was bugging you that you still see, or something that you feel like, I wish I would have not done it this way? Or do you think like overall, I'm very happy with what we have now and this is my new version of who I want to be?
Obviously it would have been great if I'd known you from the get-go, but I didn't. So it's your journey.
Yeah.
So I feel like I've got to own that. That's my journey. I wasn't happy. I was told it was deep plane. So I do think there needs clarification there.
Yeah.
I mean, you assume.
Yeah.
And I remember you said, well, you can go into the forest or you can go deep into the forest.
That is correct.
And I was going, you have to go really deep because I'm not coming back again.
This is where the ligaments are.
Oh my gosh. And I suppose, and I had all the swelling. I'm a Pilates teacher and I'm teaching. Yes. Oh my gosh.
I remember when can I start
and
teaching again?
I couldn't really, when can I start teaching again? I can afford to stop for too long.
Yeah.
Obviously it was bruising, put makeup on and just owned it. And then, obviously it looked like I'd done something, but people don't really ask or didn't ask, or maybe they were a bit fifth asked. But I was quite surprised at how well I was able to camouflage the bruising. Yeah. And then obviously there was swelling, but it didn't look awful. I just pulled my head down. Yeah. And I had a confidence and a knowledge that I knew it was going to get better. Maybe because I'd already done it once. Yeah. My concern was, would it last this time? Mm-hmm. I still had that slight anxiety, thinking, I can't keep doing this. Yeah. But it's great. I don't feel, as I said, I came back a year later because I wanted to say thank you. And also a year later, I knew, actually, this is it.
Yeah. I think it's very important to keep in mind, you live a terribly healthy lifestyle.
Yeah.
You are a Pilates teacher, so you look after yourself very well. You're very well connected with yourself.
Yes.
Looking at the journey that we two shared, if there's anything that you would tell younger Nicola before having her journey with me, is there anything that you would give her as an advice, physically or mentally? Is there anything you would do differently this time? Or would you say, maybe it's just accepting it, owning it, and everything else was fine? What do you think?
I think owning it, if I'd owned it, I think I would have been...
less stressed?
Yes, yes. Because I'm quite OCD.
Oh, really? You tell me now?
So I sort of, lots of questions. I'd sort of worked it all out with you, hadn't I? Planned it all, and we did it bit by bit, didn't we?
You said, okay, I was happy with the lips, so I thought once he's going to do a facelift, it's not going to be terrible.
I had so much confidence in you. I did not for 1 minute have that, and once the day arrived and you came in, I was just like, okay, I'd sort of, you held my hand, which was great. And I just thought, no, he's going to do it. It's fine. Yeah.
Thank you.
Can I just say also, I like the fact you were German. And so it was all going to be completely, absolutely perfect.
Of course. I remember you asked me, when will you be finished with the surgery? And I always say the same thing. The surgery is finished when I'm happy.
Yeah. Mine took a little while, okay?
Yeah, well, this is something I also feel like there's nothing that I need to hide. The reason I came to London is because I want to build a facelift clinic, and I'm in the fortunate position now to build this facelift clinic, which means we have way more patients and we focus more and more on this. Have I done 500 facelifts yet? No, I haven't. But I have 15 years of experience as a facelift surgeon, a facial plastic surgeon, and 20 years of experience as a head and neck surgeon. So all this plays into it, and I guess this is what made you believe. The thing that I would like to know, did you also gain confidence in me as a surgeon because you and I were able to speak so brutally honest? And it's not like heavy conversations, but I know you were making jokes, but still being very honest and communicating your worries and fears.
Yeah. You have to feel
Safe.
full of trust and safe. Yeah. And I did. I mean, so that's that gut feeling, isn't it?
Right. I think this is so important because it just gives my patients the understanding of, A, I'm listening to the patient is being heard, but also understood. And I feel like I'm doing this, but at the same time, I take the liberty of saying, this is not realistic, this is not going to happen. So it's not just pleasing what patients want to hear, but educating them. And I find it so important.
Yeah. And I think just your honesty was wonderful. You want to know how it's going to be.
Yeah.
And you say it. No, exactly. And it isn't like instant. It does take time. What was your biggest
crisis after the surgery?
I was really sick.
Yeah,
the meds.
Yeah.
And I remember you just saying, well, you didn't take enough, you didn't do your drugs.
Yeah.
But I mean, my body just really reacted.
Yeah.
So that was quite shocking, I think. I wasn't anticipating that. So you couldn't remove the dressing because I was so sick, wasn't I? I couldn't stop vomiting. Horrible. That was my biggest crisis, yes, because I was just like, gosh, this is just awful. I wasn't thinking about that.
How long did this vomiting and sickness last?
24, 48 hours. Yeah. Because I got discharged, but I still went home and was really sick, and then wanted to see me the next day to take the stitches out. I was like, oh, I don't think I can even get out of bed.
Yeah.
And I did make it here, didn't I? And then you got me a cab back because I was sort of lying on the setting. Oh my God. Yes. That was horrible.
Yeah.
I can't say it wasn't. But as soon as the sickness had and then I needed to take the drugs. It was, that was fine. I just feel like you put me so much at ease. You'd answered all my questions. Obviously, I'd already had surgery. I'd gone through that process once, so I was experienced with it. I just felt really confident, and I could see from the start things were different. We did the light therapy. I had that party. I knew I had a deadline. I had to look okay in 6 weeks.
Yeah, that was a tight deadline.
It was a tight deadline.
I don't suggest to do this again.
Because gosh.
But also, to be fair.
But you were still honest.
I was honest, but also, it was not the birthday party. It was a different party.
It was a different party. It was like a big family thing. And of course,
She's
because I hadn't...
too many parties.
Oh, I wish. And I think because it was a family party.
There was judgment.
And I hadn't owned it.
Yes.
There was going to be huge judgment, and I hadn't told anyone. So that was a big sort of...
Of course. Yeah, 6 weeks was a bit of a schedule, and it was not the birthday party. But the thing is also, for me, I knew how you were healing as we already did the rhinoplasty, the lips before.
That's true.
So I knew what to anticipate. And as you know me, I'm not, just saying it'll be fine.
No. And there was the light therapy. Yeah. And I think you did touch on it. But I think looking after your skin is so important.
Yeah.
I can't stress that enough, because I think, you're not a magician for the skin. So, and I've always looked after my skin. So I think that was something that I've continued to do.
Yeah, fantastic. If somebody in your circle of friends would say like, Nicola, I'm thinking of having a facelift, what's the first thing you would say?
Good for you. Yeah, good for you.
Yes.
Yeah.
Yes.
Absolutely now.
Yeah.
Yes, don't judge. It's their journey. And fantastic. I've not looked back. Really haven't. Yeah.
Thank you so much for being here. Thank you for taking your time. I can't thank you enough for your trust, your generosity with time, and also sharing this with everyone.
No, he's a good guy. Yeah.
Thank you so much.